Hi, good afternoon. It's Jonathan again, coming to you from inside Vets for Pets, Worcester. And today we're going to talk a little bit about quite a tricky subject. We're going to talk about euthanasias and what that means for you as a pet owner, and what it means for your pet, and also what it means for us as vets. So quite a lot of things to cover today, and quite a bit of emotional stuff to talk through, and quite tricky things, and it's always quite difficult. So I thought what we'd do is I'll break it up into three sections: the patient, the vet, and the owner, and what each could experience or needs to have in your mind when you're talking or phoning or contacting the practice about, do you or don't you need to consider euthanasia for a pet. So under the Welfare Act, we as vets have to provide pain relief and prevent suffering to your pet, and one of the ways we do that is by euthanizing your animal as the humane rights and the humane reasons for doing so. So if your animal is in pain or does not have the quality of life, as a term that's often referred to, that it should have, and is just not doing well, then one of the privileges we have at this stage is as a vet is we can say, with you, we can decide, is that fair on your pet or not? And we can at that stage say, no, we don't think it's fair, we're going to go and we're going to euthanize your pet. So what does euthanasia involve? It is really a relatively straightforward procedure from a surgical or a procedural point of view as a vet. It's not straightforward by any means from an emotional point of view, but from a sort of what we do and how we do it, it can be quite routine. And we do the process of putting injections into veins, etc., lots and lots throughout the day. So we're continuously blood sampling, we're continuously sedating animals, we'll be continuously in the back, in the theatre, we'll be giving IV injections, etc. So what's different this time is the powerful sedative we're going to be giving to your animal, which will eventually cause the brain to stop sending brain signals to the heart, and therefore will stop the heart, and your animal will pass away. So the actual procedure involves the vet putting a catheter into the vein, or some vets will still use the needle straight into the vein, and will then draw up a very powerful substance. And then you can get various different types of substance. The most common form is phenobarbital, and the strength of it will then determine how effective it is. And then we're trying to take your pet through the stages of a sedative to a sedation, to an anesthetic, through to the anesthetic depths, to make sure that we can stop the brain signal. So the first stage is actually slight sedation. The second stage of this four-stage process is actually excitement, and this can be quite alarming if it happens to happen because the drug is working quite quickly. You can sometimes have your pet vocalize or cry out, which is very, very distressing to the vet and yourself or anyone that is involved there at the time, because they will sound like they're in pain, but it is actually in its excitement phase, and they will vocalize and they'll make quite varied sounds. Some of them are loud, some of them are not, but I've not seen it happen too much with the products we use, because we use extremely top-end and very expensive phenobarbital forms to make certain that it is as smooth as possible, so it's not a rough induction, so it's a smooth, straight through those processes. The third level is the level where we do surgery at. So if your pet was coming in to have surgery done, and we wouldn't be using phenobarbital, we'd be using other induction agents, we'd be taking you down to level 3, where we then would do anesthetics. And then we have to do a lot of monitoring, because at that stage we're trying to prevent dropping into level 4, and that's where we over anesthetize. And that's what we're trying to do. We're trying to get to that level 4 as quickly as possible, where we euthanize an animal. Basically at that stage, that's when you get cardio and respiratory suppression, and that's because the brain stops sending the signals basically through to the heart. And obviously at that stage the vet will listen to your pet, listen to the heart, and confirm, yes, the heart has stopped. However, sometimes after that you will occasionally see your pet or your animal take a breath, and once again, if you were dealing with me, I would have warned you if this could happen, and it's quite alarming as well, because one of the hard parts about euthanasia is that even when the vet says they've passed away, they still look very much alive. In fact, they look like they're sleeping, and that's where the phrase "put to sleep" has come from. We don't use that. It's better to use euthanasia because it's a correct terminology for it, but that's why they look like they're asleep, and they look like they're very much awake and alive, or asleep and alive. When I first qualified, this was quite quite distressing as a vet and quite an emotional challenge to actually work through and just explain to the owners while you there yourself looking at the pet thinking, are we sure? But you to check the heart and you check. And then afterwards there's a couple of reflex breaths, and once those stop, the animal's passed away. And then that's the euthanasia process from a clinical point of view done. Now, as an owner, we're often asked, when should I euthanize my pet? How do I know? And the short and long answer of that is it varies from every single pet. But as an owner, you know your pet intimately and very, very well, and you will get a good sense of whether there's the quality of life or the suffering or just not able to do what you would like the pet to be able to do in your environment, your animal in your environment. And if you are really struggling, then please come down to the clinic, have a chat to us. We have some forms which you can fill out, and that helps us to determine what you think the quality of life is for a pet. They are called quality of life forms, and they are available from the clinic and the practice as well. And they just might point you in the right direction, because I think as an owner, you're always in this. From when you're born, you're taught you have to always pick the right option, and that can be quite tricky because it's not always clear what the right option is. The right option might be due to finances, the right option might be due to quality of life, length of treatment, the risk of recurrence of a tumor, the risk of getting through the surgery. It might not be as straightforward as you first perceive it to be. So there are a lot of things there, but I always tell my clients that you don't have to pick the right option. There's a three-way process. It's the pet, the vet, and the owner. And between the three of us, we will make a decision that is the best for everybody involved at the time. So it does get tailor-made to you, and that is important to have that consultation and have that discussion with your vet in the clinic. Okay. I think that's pretty much from that point of view. I think the other thing that's really important to remember is that it is very sad, and it's allowed to be sad. It should be sad. If it's not sad, then something's not quite right. So it is a sad process, and that is the hardest part about it, is saying goodbye, and that can be emotionally draining on the vets, and in particular if you have to do more than one euthanasia per day, which I don't think owners remember that, or sometimes don't realize that we do sometimes have to do more than one. And we actually, as a team, we will spread that around if that's what's happening. If we have a few on a day to euthanize, we will make certain that our vets don't have to euthanize too many animals. And the reason for that is I suspect it's one of the triggers for sometimes post-traumatic stress syndrome and stress at home and stress in the workplace, and there's a lot going on. So we do spread them out between the vet team so that we can then cope with that emotional strain. So we know as owners it's very, 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 very taxing and very sad. And often one of the things you have to think about as well is, are you coming by yourself? Are you going to be driving afterwards? So we always feel very concerned about that aspect, because if you were driving afterwards, I think you could probably not be the best friend of mine. So we often just would advise you have a seat, have a cup of tea, but you're upset, you're crying. Some people just want to head off from the clinic as quickly as possible, and that's understandable. And one of the things we try and do to smooth that process through is we will always try and take the payment for the procedure beforehand, in the consult room in privacy, so that you're not having to stand on the front desk and wait and be embarrassed and upset. The other thing that's important is we also do home euthanasias, and that's actually probably in my experience turns out to be the best for everybody, because it's quite a nice environment. Well, of course it's a nice environment, it's your home, but it's a nice environment for us as vets to go to as well. So it helps us, it helps a pet, and it's quite a nice way of doing it, and probably my preferred method of where I like to euthanize animals. Sometimes not always possible, but in our clinic it's always possible to book an appointment on the day, and we will always come out to you and make certain that we're there for you for a home euthanasia if needed. The next and the final stage is obviously now we've euthanized the patient or the pet, and we now need to know what are we doing regarding the cremation options. And obviously you have the option to have the ashes back, and these are all things we can actually, if you're planning ahead and you're thinking about, there are these options you can have a look into beforehand, and you can come down and pick up a leaflet from the clinic, and we'll go through all of the urns and caskets and photographs, and there are all sorts. You can even, and I've heard of this being done, is have the ashes back and have them turned into diamonds and all sorts of options, whatever suits everybody. For some people, they just want to say goodbye, and that's enough, and they don't want to have any ashes back, and that's fine as well. So we take care of that, and we use a company that are very reputable, and they look after, and the body is kept in cold storage and then cremated. So it's important that the duty of care doesn't just stop once we've euthanized the pet. It does carry all the way through, and the responsibility for that carries all the way through, and it's all tracked and recorded and monitored to make certain that it's meeting legislative standards, and obviously we want you to know and have confidence that we're looking after them even once they're euthanized. Okay, I think that's probably all I'm going to talk to you about today. I was thinking that this would lead nicely into the next option, and maybe a shorter vlog, and that would probably be on palliative care. And that's quite a tricky one, because that once again needs a lot of veterinary involvement, and that's when you have a terminal condition. You obviously are considering euthanasia, but there's still quite a reasonable quality of life, and you need guidance on when to help and say enough's enough. So that'll be the conversation for the next vlog. Once again, thank you for watching, thank you for listening, and we'll catch up with you next week. Thanks a lot.